also the community's trust to making sure that we are not breaching any of those confidentiality by sharing all of that information. And we will take all the appropriate measures, all the appropriate actions to limit the spread of the disease in the community by whatever it takes from a public health control perspective. So I just want to assure everyone that this is the situation. We do not have any case, and we will notify the community directly if there is one. And I'm happy to take any questions if you have.
Could you speak in French and say the...
I am not a bilingual. I'm sorry. I don't know if someone else can do that.
The public has asked us about an apparent issue developing at FCA right now. There's reports from a number of workers there that a portion of workers are refusing to work because of some type of suspected case of coronavirus. Have you heard anything about that type of situation?
No, we have not, and I think that's why we really want to be careful in what kind of messaging and what kind of message we are sending out to the community. Messages like these sometimes can create more anxiety and concern in the general public. Right now, even when we are looking at the media, either local or international media, provincial media, everyone is putting out so many information out there, and that's making a lot of people anxious. We're not aware of any of those things, but we really want to make sure that we are working. Our staff are fielding phone calls right in the day, like right from the morning until the end of the day, and even extended hours. We have seconded staff to support with that process to make sure that we are responding to some of those requests. As of now, we are getting inundated with calls, and we haven't seen the number of call volumes that we have seen in the last week. So that's another message that I want to send out to the community, that if you're contacting us, there may be delay in getting back to you because there are so many people who are calling us, and we are triaging them to make sure that people who are on the high priority or a higher risk, we are attending to those calls and those questions first, and then we are going back to the other ones. But we want to assure that there is no case and there is nothing that people should be worrying about, and we are working with all our resources possible to provide the information and support that the community needs.
How close are conversations with the border, with CBSA, when it comes to foreigners traveling across the border?
So those directions generally come from the federal government because they are federally operated. What we have been hearing from our provincial ministry is there's been some direction given directly to them in terms of what their processes are, and we do not have any direct contact with them with respect to what they're doing.
In terms of the announcement earlier today from Hotel de Grace Healthcare and the physician who has symptoms that appear to be those of COVID-19, how was the health unit involved?
So I can't speak to any case because of respecting individuals' privacy, but what we always do is when we get this type of individuals who are who requires any kind of testing. So we refer them to their healthcare provider to get the assessment done and get the testing done, and then once it happens, then our team follow up with them. They're advised to self-isolate for most of the part, whoever is tested, until the time we get the results back, and depending on what their risks were in the beginning, they were advised for the next step. But anyone who is being tested, anyone who's coming from these countries, especially the high-risk countries, we are tracking all those individuals, and we have the information. We are connecting with them, everyone who is self-isolating, about their symptoms, to make sure that they are not developing any symptoms which could be a symptom of COVID or any other thing.
How soon was HDGH in touch with you once they received the information that they got?
So can you repeat your question again?
Just wanted to see if as HDH received the information, how soon after that was the health unit told about it, if they were at all?
So we were, obviously everyone is super busy in terms of what we are doing. So I've been in meetings one after the other and still catching up on things. But we want to make sure that any kind of this type of messaging, it will come from us, and we are testing individuals every day right now. So we don't get and we don't follow up with all of those, and we don't report back to the media every day, respecting individuals' privacy, and this is what we will continue to follow.
Forgive me if I missed this, Dr. Ahmed, but how many self-isolation cases are we tracking right now?
Do we have a number? I'll just. So far, how many we have tracked, or? 9 are currently under isolation. Nine individuals are currently under isolation that we are following up every day to make sure that they are not developing any symptoms. No, we are calling them. So it's a phone call from our staff, and we're going through the list of symptoms and then any education that we need to provide with them.
9 are under
Isolation.
But at the hospital they said that there are 20 people who work at the hospital who are in isolation.
So those are. So if we are asking if they are at a high risk of having the disease, those individuals, we ask them to self-isolate. If an individual or someone is self-isolating themselves, that's not our advice. And because based on the guidance, they need to just be mindful of their symptoms. If anyone is coming from some of the other countries that do not have that high number of cases, if they're concerned, they are told to monitor their symptoms. We are not asking them to self-isolate as per the public health management guidance document.
So to be clear, the 22 people that are self-isolating from the hospital are doing so under their own permission from the hospital?
We don't have any information because we didn't ask them to self-isolate. So those are the individuals that we are following, were advised by us to self-isolate.
When you're self-isolated, can you go to a detached garage on your property, or do you need to stay confined inside your home?
Again, depending on what potential risk that you might be exposing yourself to, if you have more family members, if you have high-risk individuals in the family who may contract the disease. If someone is living on their own, yeah, they can. The only reason, the way an individual is spreading the infection is when they're out and symptomatic, coughing and sneezing, and just throwing all these viruses in the air, then they're potentially exposing other individuals. So when they're self-isolating, and if they are asymptomatic, obviously we're still asking them to self-isolate until we get the results back. But if they're symptomatic, there has to be some kind of a health assessment done, and then they are following the advice of their physician. From a public health standpoint, we definitely don't want them to expose anyone else with the potential virus. So they're basically asked, even if they have to go, making sure that there's no one around, and they're wearing a mask. If they're coming out of the room, they have to have like a dedicated washroom that no one else in the family is using, things like that. So we do that with other cases as well, which is pretty standard what we tell them.
What's your communication like with doctors' offices and physicians' offices? I went to one today where there's a sign on the door that says, if you have a cough, go to the emergency room, which is against all other advice.
It has been a challenge, and I won't lie about it. It's been a challenge. We are trying to get to all the physicians in the community, sharing the message that we need your help, we need your support. This is something which has been now declared a pandemic, and there's a lot of anxiety in the community. There have been hundreds of thousands of cases around the world, so people want to be seen. Anyone who's having a cough, especially in Windsor and Essex, in the absence of a confirmed case, they may have something else. So they need some kind of a physician assessment or a healthcare provider assessment before they can be triaged to say, yes, you may be a possible case, then maybe we need to do further testing, or maybe they have influenza or some of the other important disease that requires assessment. So my worry is if these people are being turned away, and if they're going to the emerge and potentially exposing other individuals, and everyone is just going to the emerge, what about those who are actually having a heart attack or some kind of a stroke? What would happen to them? So it is important for the healthcare providers even to understand that there is a role for them. There is good scientific evidence, scientific guidance documents available for primary care providers by the ministry that they can follow, which is not saying that turn your patients away. There has to be some assessment. I think this is the message that we've been trying to share with our healthcare provider, but it is not easy to convince them.
How many confirmed cases of influenza?
It would be in our respiratory bulletin, and while we are talking, Christy can maybe just give me the number. 150? They're close to. So 150 cases close to.
I can't remember if that's a lot or not.
Well, it's hard to say if it's a lot or not because the testing protocol changes all the at least it has changed in the last couple of years. So far from a severity perspective, we can say that it's been generally a mild influenza season. 163. So it has generally been a mild influenza season, and so at least that's saving us from some of the other outbreaks in the community.
Are you still sticking with the advice to call Telehealth Canada first or check your website before you start walking out in the world?
Well, we are asking them to at least get the right information first. So our website is have a lot of good information. There's a ministry website that's up and running. It has a lot of good information because realistically, if everyone is concerned, everyone is anxious, they want to talk to a person, it delays the whole system. We know how the system works, right? We have staff who are trying their best to answer all those calls. It's getting very, very difficult to get back to them in the timely manner. I can't speak for what's happening with telehealth, but at least get some information, get some facts straight. And if you're really concerned, I think after reading that information, your best bet is to talk to your healthcare provider and see if you are suffering from something else, which needs to be assessed and investigated. And then if all of that, and if the physician, whoever they go to, they decide that based on their clinical judgment that they want to test this individual, so then that comes the next step in terms of how do you do the testing and where it goes and all that.
Going on to the hospital.
Well, yeah, I think, yeah. But if you're sick, like, let me just be very clear. If you're really sick, if you have any pressing issues, feel free to go there. But I think that's the determination that an individual has to make. I cannot say that don't go to the hospital or go to the hospital. If you're really, really sick and you're thinking that I need some kind of a hospital care, go to the hospital. If you're at the point where your symptoms are suggesting a very severity, like having like a real difficulty in breathing, almost feel like you can't breathe, call 911 because that's what we will say. And by the time, if you're calling us, trying to get hold of us, we won't be there. So I think there has to be some responsibility at an individual level from what they are doing, getting themselves educated. We have been doing lots of messaging. The ministry has been doing lots of messaging to make sure that everyone is aware of what is happening. We have been consistent in sharing the message. There is no confirmed case of COVID-19 in our community. We've been sending out good messages that people can take measures to protect themselves from COVID-19. So I think we want to make sure that people are doing all of that, and then if they have additional questions, then try the other resources such as telehealth or contacting us or contacting their healthcare provider.
Of those who are currently in self-isolation, can you give a number as to people who are in the healthcare sector, whether that's physicians or whatnot?
I don't have that breakdown as today, and even I think I would want to review whether if we are not breaking any confidentiality, so I cannot give you any breakdown at this point.
Can you speak to how stretched hospitals might be over these concerns, perhaps bed-wise?
I think that's the question that you should be directing to the hospital. But what we can see, I think, as a system, if everyone is want to go to the hospital, it overwhelms them. So I think we have to be responsible in referring and sending those individuals to. Okay. All right. Thank you very much for coming. All right.